Gotcha. And that raises another question, which I don't know if this is an uncomfortable question or not, so I apologize in advance, but it's a question that I hear quite often, is that some eye care providers who do myopia control charge for these consultations,
Yeah.
and some do not. And
Right.
I thought, why not ask Nick, do you charge for that consultation? And if so, or if not, why?
This is a great question. The answer is yes, but I didn't for the first 10, 12 years. I was scared to
Okay.
death.
Okay.
I'm embarrassed to say it. And I'd give hours away. And the reason I was scared, I was like, I figured they're going to love me.
Hmm.
Yeah, they're going to love my office. This is Dr. D. And it worked. It worked really well. At that time, I could tell you, we would get about 87% acceptance. And then about 5, 7 years ago, Matthew, something happened. My conversion rate dropped to low 80s. And once it hit about 76%, which is not terrible, right? 75%, 3 out of 4 patients would enlist in our program. Like, this is not working. I'm getting window shoppers. I'm getting people which are benefiting from an extraordinary event, just giving away my time. So now we do charge, we call it share cost, about an hour of our time. We still don't make money from the consultation, but now that basically shows us how interested are you in arresting or slowing down your child myopia.
Hmm.
And even though at first we took a hit, now there are quality patients in my chair,
Right.
and the conversion went up. And that's really what I'm interested in. I
Right.
don't want to just educate you and leave. I want you to enroll in my program. The other thing we've done is we ask for a deposit. And I notice when I go to a specialist that doesn't run late, they would ask for a deposit for me. And what they're basically saying is like, we're reserving this time for you.
Right.
And that this deposit assures us that you won't show up, because when I didn't charge for a consultation, sometimes I got no shows, and that hurts,
Yeah.
because the way we quantify our success is we allow certain consultation visits per week, and we monitor how often they're filled and how often they convert once they're filled. So we go that far doing it. So I've done it both ways. And what I was going to make a recommendation, I would charge right now for a consultation, whatever you feel comfortable with, because that shows how serious the parent is.
Right.
That was a good question.
It also shows how serious you are, because you're
Yeah,
basically saying to that patient, look, my time is valuable and this is an investment, and I'm not going to waste it on somebody
right.
who's not going to be invested. Like, we all like to make money. We all want to be successful, but, I'm sure there's many optometrists who can relate to the, no call, no show, and then you give them another chance and they do it again, and then you give them another chance and they do it again. And at what point are you going to say, look, this isn't worth it? Like, you're
Yeah,
just stringing me
yeah.
along. So,
And the thing that helped me with this is that many of my colleagues don't charge for it, and some
hmm.
parents value that. That's good. Same thing with this no-show fee. My fear was when a patient showed, like primary care, we have a no-show fee. And basically, my fear was if I charge you, that you'll go to my competitor or my colleague. It's okay. You
Hmm.
can't be everything to everyone. And I think in optometry and ophthalmology, we feel we need to be everything to everyone. And we cannot,
Hmm.
you can't prosper being everything to everyone. It's okay if they are serviced by some other eye care practice. It's fine.
Yeah, for
It
sure.
actually works in our benefit in the long run, to be honest with you,
How so?
because sometimes they say, oh, okay, now experienced Dr. D's office and Dr. Tannen's office and Dr. Lee's office, and
Hmm.
I've experienced Dr. B.
Hmm.
And she's very nice, but she may not be the same, and they'll come back. So the thing is that parents talk, and that helps us. It can hurt us, it can help us. The community talks, and when a parent's not being um, serviced to their child is not cared for to what they expect, word gets out, and then price becomes a non-issue at that point.
Hmm.
It really doesn't. Whether you pay little or a lot, depending on your standards, what matters most to a parent is how well their child is cared for.
Right. Yeah, you're not just offering an ortho-K treatment. You're offering a practitioner that cares about your child, that takes this seriously, is willing to spend the time with the patient and the parents. And let's face it, like that's not what the standard of care is out in, regular optometry. That's why docs come to the AAOMC, because they got sick and tired of just rapidly seeing patients at the behest of, chair time and keeping up with insurance and whatnot. So,
Yeah.
you
Yeah.
know, I,
Yeah.
I I like the idea of being like, my experience is unique and special, and I'll spend the time with you, but it's valuable. And I
Right.
think people ultimately respect that, whether you charge for your consultation or not.
Or not. Right.
I think if you
Right.
can impart the ideas that we've talked about in podcasts up to this point and this one, about imparting that you are special, that this is a special experience, and you, the practitioner, are invested in that experience and that patient, I think that goes a really far way with them. So.
Yeah.